Welcome everyone to today's webinar, Simultaneously Advancing Patient and Staff Engagement Through Intelligent Automation. I am Christelle Kazaka with Becker's Hospital Review. We will begin today's session with the presentation and will follow with the Q&A conversation. You may submit any questions you have throughout the presentation by typing them into the Q&A box you see on your screen. At this time, it is now my pleasure to turn the floor over to our presenters to begin today's presentation.
All right, thank you all for joining us for today's webinar. We're really excited to be talking about how to advance patients and staff engagement through intelligent automation with Notable and Fort Healthcare. To start with some introductions, my name is Muthu Alagapan. I am the Chief Medical Officer at Notable Health, where I oversee new solution development. I'm a board-certified internist and hospitalist, and I have a background in clinical informatics. I'm joined today by Carl Selvik, who's the Senior Director for Clinical Operations at Fort Healthcare. Fort Healthcare is one of the newest partners on the Notable platform. Carl, thank you so much for joining us. Do you want to give us a brief introduction?
Absolutely. So happy to be here, Muthu, and appreciate that kind introduction. So my name is Carl Selvik. I'm a pharmacist by background and serve as one of our administrators at Fort Healthcare. So we have a $300 million regional facility. And in my role, I oversee the outpatient operations, which includes about 15 multi-specialty primary care and rural health clinics. I'm the administrator for our medical group, and then the executive director for an accountable care organization, and then oversee some of our telehealth and digital strategies. Thank you.
Great, thank you, Carl. So today we'll be covering three main topics. To begin, I'll be discussing the market forces that drive and are driving the industry towards intelligent automation. Next, we'll talk about what we call the dual mandate, how we can advance both patient and staff engagement with intelligent automation. And then finally, we'll draw on the expertise of Carl as he talks about driving engagement through intelligent automation at Fort Healthcare. And of course, we'll leave some time at the end for questions. So to get started, we'll begin in the first section, which are what are the market forces in the industry driving us toward intelligent automation, and why is the time for intelligent automation now? So in healthcare overall, we've talked for years about the triple aim of experience, outcomes, and cost. And we've shown that here. For years, these have been the priorities of hospitals and health system executives. Yet despite these overarching priorities, we've found, and many in the industry have found, that we're still not moving far enough or fast enough. We've, and seen many health systems make significant enterprise-wide investments in everything from massive enterprise electronic health records, new financial experience tools, enterprise analytics and CRMs, and new population health dashboards. Yet despite these investments over the course of many years, we're seeing that we're still not close enough to the four overarching aims of health systems, which we've listed on the top of the slide. We'll actually dive into perhaps some of the root causes of why we're not moving far enough or fast enough in the coming slides. So we'll begin by talking about experience and outcomes. On the left, we've shown a simple graph that shows that almost half of US respondents are not satisfied with their experience in healthcare from a sample size of over 15,000 patients. And this is striking. Despite all of the investments in EHRs and other platform technologies, almost half of US patients are still not satisfied with the quality or experience of their care. But it's not just the experience, it's also the outcomes. On the chart on the right, you'll see that when compared to other countries, the United States healthcare system is one of the lowest performing in terms of outcomes. So this slide is quite concerning, showing that both the experience of healthcare in the United States and the outcomes of healthcare are lagging behind other countries and our peers. But the story sort of gets worse. If we go to the next slide, you'll see that it's not just experience and outcomes, it's also efficiency that we haven't made any gains on over the last decade. On the left, we've shown a chart of hospital EHR adoption over the last 10 years. You'll see, as many know, there's been an exponential rise in EHR adoption, where nearly every health system and provider group now is on an electronic health record. One of the main reasons for those investments was hopefully to achieve some sort of productivity or efficiency gain. Yet on the graph on the right, you'll see that over the 10 years from 2009 to 2018, the number of employees per thousand of admissions stayed the same. So despite the EHR adoption increasing exponentially, we were no more efficient at taking care of a set of patients than we were before EHRs became mainstream. If we go to the next slide, you'll see that administrative burden continues to rise in the United States. The graph on the left is quite striking. It shows that physician growth in the United States over the last 40 years has been almost stagnant, right? There hasn't been a huge increase in the number of providers in this country. Yet despite that, administrative growth has actually increased quite linearly over the last 40 years. Administrative growth is far outpacing physician growth, which simply means there are more and more staff that are required to take care of every patient that's in the healthcare system. And this is a uniquely United States problem. If you look at the graph on the right, you'll see that compared to other countries, the United States has far more administrative costs in healthcare than any of our peers. So to recap what we've discussed so far, in the US healthcare system, the experience of care is poor, the outcomes are worse than our peers, and also we're not having the efficiency gains that we expected from EHRs, and administrative costs are only increasing faster than we can control. And the future of healthcare in the United States really shows no slowing down of this administrative growth. In the last 2 years, we've seen a new market force as well, which is competition that is threatening traditional health systems to gain market share. On the left, you'll see some of the common headlines showing the dramatic increase in hospital M&A activity throughout the last 2-3 years during the pandemic. And on the right, you'll see that when you survey leading health systems, almost all of them consider non-traditional competitors to be a strong threat or an extreme threat. So this is everyone from traditional payers to corporations like CVS and Walgreens to big tech companies like Amazon and Apple. So the healthcare ecosystem and environment right now is really quite, has a lot of market forces going on at one time. You've got the poor experience, the poor outcomes, the increased administrative burden, and then this concern of competition from non-traditional entrants to the market. Despite kind of the lack of progress that we've talked about, when we think about what are the proximal causes of sort of the lack of progress that the industry has made, we believe strongly that one of the biggest causes of the lack of progress is the manual workflows that are holding back the industry. There are hundreds of manual workflows in healthcare, too many to list on this single slide, but we've listed some of them on the left. You've got thousands of paper forms in every health system that patients and staff are manually entering in. You've got issues with reconciling data across payers and providers and population health organizations. You have massive call centers making hundreds of thousands of outbound calls to engage patients. You still have a dramatic use of faxes to send referrals and to transmit information, and then hundreds of work queues in each of these systems. So this complex lattice of manual interactions and the number of administrative staff needed to keep this machine going is really quite overwhelming. And we believe it's one of the main reasons that the industry is being held back. So what's the answer? We've painted sort of a difficult picture of where the industry sits today, but notable, we have a lot of optimism that intelligent automation can really address these repetitive manual workflows in healthcare. So before we go any further, I want to define what intelligent automation is. So we consider intelligent automation to be the unification of RPA and AI, where RPA is robotic process automation, which is simply the ability to train software robots or bots to perform processes in a software application like an EHR, just like a human being. So we can actually train bots to click on buttons, to fill out forms, to upload documents, to write notes, all using virtual computer interactions through RPA. And AI, as many of us know, is artificial intelligence. It's the intelligence capabilities that bots can have to mimic human intelligence, things like predictive analytics, the ability to look at a picture of an insurance card and understand who the payer is or what the member ID is. It's knowing when best to reach out to a patient to have the best chance of them responding to you. So intelligent automation takes the best of automation through RPA and the best of intelligence through AI, and we use that combination to address repetitive manual workflows, meaning we can perform healthcare workflows in place of manual staff without having to bring in new point solutions for every new problem. We can also minimize the need for in-house development because we can simply train bots on existing workflows and have them perform those workflows as adjuncts to their human counterparts. And we can reduce change management by, rather than introducing any new workflows, we can simply automate the ones that exist today. So we went through a lot in that section, but just to sort of highlight the high points, the US healthcare industry has simply not made enough progress despite the massive investments that the industry has made. Yet we believe that intelligent automation, this ability to combine RPA and AI, sort of unlocks the ability to automate all of these, the millions of manual workflows that exist in the industry today, helping us get efficiency gains and reprioritize our focus towards high quality care and top patient experience. With that, we'll go into the second section, which is the dual mandate. How do you use technology to actually advance both patient and staff engagement rather than having to trade off the patient engagement for the staff engagement or vice versa? So through this section, I'll actually be calling on Carl to provide some of his insights as we're going through and to hear about how much of this has gone at Fort Healthcare in his work. So to start with, this is a really interesting chart, which shows that patient and employee engagement are actually really intertwined. What it shows is that when you have greater than a 1% improvement in employee engagement, for example, nurse or provider engagements, and you also have a greater than 1% improvement in the amount of communication that nurses do to patients, so a kind of sort of a proxy for patient experience, that quadrant actually results in an average of a 6-point HCAHPS score improvement for health systems, right? So when you focus on both employee and patient experience, it actually improves your HCAHPS scores, which we know is then associated with it a 1% increase in profit margin. I'll actually call on Carl quite early here to just talk to what you've seen at Fort Healthcare in terms of the trade-offs between, maybe optimizing employee engagement, but then losing out on patient engagement or vice versa, and where you've seen that actually doing both can be helpful in your clinical operations.
Oh, I just, one of the areas that we're experiencing in healthcare right now is the Great Resignation. So, we are leading through a pandemic. It is incredibly difficult. And we're going on year 2, where it's very difficult to engage employees in this difficult and rewarding work over the long run. So, one of our strategies to help support employees is to make sure that we're connecting them to the mission and vision of the work that we're doing. That's really hard to do when they're going to school and we're coming out and we just have a clunky EMR process. I hear that from providers all the time of the amount of time that they spend charting and documenting. And it really gets in the way of patient care. Obviously, that then translates over to the patient experience. So it's not one or the other, it's both. And, one of the journeys that we've went along is how do we, the dual mandate, how do we improve both the patient experience and employee engagement together? And so it's really listening to the concerns that people have raised. There are no secrets in healthcare, but I strongly believe that usually the problem and the solution are right next to each other.
That's great. Yeah, thank you for sharing. And you mentioned the Great Resignation. I think we're seeing the staffing and labor shortages and also the increase in work sort of across the industry. And so just great points about how actually focusing on that, leaning into that can actually then translate to a better patient experience as well.
Absolutely.
So here we wanted to break down what are some of the frustrations that patients and staff experience across the journey. So kind of across from left to right, we've broken, healthcare experiences into three segments. The first is seeking care, sort of the scheduling and access process. The second is optimizing the visit, which is what do patients and staff need to do to get ready for an upcoming visit that they have? And then finally is engagement and follow-up, which is all of that time in between visits when patients are sort of on their own. What are we doing to make sure they're getting the best quality care and staying engaged? On the seeking care bucket, you'll see that the frustrations are not just felt by patients, it's also felt by staff. So for patients, it's notorious how difficult it can be to schedule an appointment, especially with a specialist. And many patients still resort to having to pick up the phone and call a call center. But on the staff side, there are an equal number of challenges. It's the massive call volumes that they're having to face on a day-to-day basis. And it's having to integrate multiple point solutions to understand how to solve a particular issue, not to mention having to learn the scheduling kind of nuances of so many different provider calendars. On the optimizing visit bucket, this is a well-known frustration for probably everyone on the call. It's the lengthy in-office paperwork that even in 2021 or 2022 now, we're still being handed a clipboard and a pen and having to fill things out on paper. Oftentimes questions that we filled out just a few weeks ago with a different provider. And on the staff side, all of those paper forms have to be entered by staff into the EMR, which can be equally sort of troublesome and arduous. Simple things like scanning hundreds of insurance cards per day can really cause quite a bit of burnout amongst staff. And then finally, on the engagement and follow-up, for many patients, as soon as they leave the clinic, they have no idea what needs to happen next. There's no follow-up or follow-through, and they can sort of be lost in the gaps of the healthcare system. And for staff, it's equally difficult when a single MA may be managing a patient panel of more than 2,000 patients. It's hard for him or her to know who to call and when, and even have the time to make those outbound outreaches.
I just add here one of the on that slide, one of the statistics that we saw that we knew we had a problem is in seeking care. So we did analytics, and 38% of the calls in our busiest clinic were going to voicemail. That problem had gotten so significant that it was creating negative feedback loops. Patients were calling multiple times because they couldn't get through and get their question answered. And because we didn't have the right workflows, the right processes, and the right technology to support us, the amount of work was actually increasing comparatively to the number of patients that we had. And the other item that I want to emphasize on optimizing the visit. So you mentioned that slide where it's no secret. We have some of the highest costs in healthcare than any of the developed countries. And the quality of our work is pretty poor comparatively. So there's that huge gap. So as a patient, we're going in and you have 15 minutes with your provider, and the first 10 minutes is spent by all of this quality-based paperwork, these screenings and these questionnaires. They have to be repeated every single time before I can get in there. And as a patient, I'm paying large amounts of money to see my provider and talk to them about this care visit. And before they can even get there, there's all this paperwork. So that was part of our journey, was that we were in a quality meeting, and the phrase came out, hey, we need this quality screening, let's put in the patient visit, and it'll only take 1 more minute. 1 more minute? I've already taken up 10 minutes. They have 5 minutes with that provider. Absolutely not. There has to be a better way.
Those are great anecdotes. I think the last one, especially, that sort of death by 1,000 paper cuts, where those minutes add up, and it's not, to your point, it's not just the patient who's waiting 10 minutes to see the provider. It's also the provider who now has that much less time to actually do the job they were trained to do. So that's
absolutely,
very helpful. If we go to the next slide, we want to sort of introduce what it is that Notable does to, bring intelligent automation to the industry and solve all of the problems that we've been talking about. So Notable provides the leading platform for intelligent automation, again, combining the best of automation technology using bots and cutting-edge artificial intelligence, where the bots can be trained to perform workflows with levels of intelligence that allows them to do this administrative work on their own. So the bots have the ability to register patients, to perform scheduling, to process a referral, submit a prior authorization, and much more. The bots can also do this with speed and agility, often faster or at the same speed as humans today. Not to mention, though, that bots can work 24 hours a day and will never sort of quit, and also can be elastically scaled. So in periods of high demand, for example, a COVID surge or a new vaccine rollout, you can elastically scale your workforce of bots to meet the increased demand. And then finally is patient engagement. So oftentimes automation on its own forgets about the importance of patient engagement, but through Notable's intelligent automation platform, the way the patient experiences that platform is just as important to us as how much work is getting done. And so we really prioritize both the patient's experience moving through the healthcare system through Notable's web application, and also the efficiency in the back end for staff and providers to help automate many of the manual workflows that they'd otherwise be doing.
Yeah, I want to kind of emphasize your point on looking at it from the patient's perspective. So technology is only as good as the people that you have behind using it. So this is really great technology. But what we've seen in the industry is that when you add on technology, we're one of the only industries that you actually increase the amount of people that you need just to manage that technology. So one of the areas that we have partnered is being able to engage patients in a one-way direction. So helping, map the workflow that they experience with us and being able to solve their questions proactively. So that comment that I made on 30% of our calls were going straight to voicemail, creating a negative feedback loop. If we could have solved that patient's question right there, gave them the tool and technology to solve it from a one-way direction without needing any of our staff, that would have pulled that whole volume away from us. So that was some of the strategies that we have used to engage patients. And that allows us to kind of meet patients where they're at, whenever they're at, living in an environment where we're not open 24/7.
Yeah, that's a great point to add. It's not about making call centers more efficient necessarily. It's about preempting the calls before they even reach the call center. All of those calls that are hitting the voicemails. How do you sort of predict and reach out to patients before they even need to call in and have that concern?
100%. Couldn't agree more.
Great. So we'll actually go into a little more detail here on Notable's intelligent automation platform on the next slide. You'll see that when you invest in a single intelligent automation platform, that platform can service the entire health system from end to end of the care continuum, just like your EHR services all of your documentation needs across the care continuum in a health system. So when we think about intelligent automation, we don't think about it as being applied to a single use case. We rather think about it as an automation platform that sort of serves your entire healthcare enterprise. All the way on the left in the patient access buckets, using automation to accelerate and improve registration, a place where your patients can go to schedule and have the bots sort of be able to triage the patient appropriately and get them booked for the right appointment. Having automation do your check-in and all of your clinical forms and having that data flow back into the EHR in a seamless manner. And having that same intelligent automation platform then do tons of other things like care gap outreach and patient-reported outcomes, where in between visits, the bots are reaching out to patients as soon as they become due for a particular care gap or when they're due to fill out a PRO. And then also having bots service your back office functions, whether that's submitting an authorization, first of all, checking if an authorization is needed and then automatically submitting it and statusing it, improving your ability to do risk adjustments and submit the right codes, and also preventing denials, whether those denials are coming from eligibility related concerns or from denied authorizations or any other cause. Having this elastic fleet of intelligent bots across your health system serving as an adjunct to your human staff, allowing your staff to focus on higher level tasks. So sort of the last point I'll make here is all of the boxes you see in blue are actually real capabilities that the Notable platform can provide today. And I think Carl will go over some of these in his section as well.
I just, a few items on here is, one of the areas that we've really enjoyed is how these processes work with each other. So once you solve prior authorization and care gap outreach, those two areas, they synergize together. So now as we're doing care gap outreach, and we do a registration with that care gap outreach. The patient clicks it. Automatically, once they've scheduled that visit, the prior authorization module takes effect. So it automatically submits it to their insurer and going back and saying, hey, when would you like to schedule this visit? So all of these have been really well thought out to work dynamically together across that patient care continuum. And that was part of our strategy of, if we're digitizing that and putting that power now in the patient's hand, we wanted a kind of a one vendor solution where all of these would work back and forth with each other. So just kind of wanted to emphasize that point on some of the value that our partnership has brought to our community.
Yeah, thank you, Carl. We haven't shown these as connected, but that's a great point. There's a ton of connections between each of these modules, and that's what sort of allows the efficiency gains and sort of the platform to shine. So thank you for sharing that. On the next slide, we're not going to go over this, but you'll see in bullets here all of the capabilities and workflows that Notable can automate through intelligent automation. And we've bucketed them into these big sort of operational buckets, whether that's access and intake or pre-visit planning or payment collection. And each of these are areas which, it may be difficult to realize at first, but each of these are areas where bots and intelligent automation can actually automate the process end to end. And to Carl's point, this is where we get some really nice platform effects where, the same bot that's doing a process in bucket one then has the information, can seamlessly flow into another workflow that it knows how to automate. And you get these really nice synergies across the system through automation.
If you want to talk about patient experience, right here, if you're not a high utilizer of healthcare, you kind of forget about all of these manual processes. What's been most impressive about this technology is how they work together. So once a patient fills this information out, every time they come to a visit, if they're coming every week for an infusion, we don't have to ask them, what's your insurance card? What's your address? All of those items, it goes from inputting to confirming. So, it has that bidirectional flow, which in healthcare is kind of unique.
Right. In other industries, it's sort of assumed, but in healthcare, to your point, it is unique. And so we have sort of an internal mantra of, never ask a patient, a question twice. So if we have the data, we're going to fill it in. This is, just to build on Carl's point there, this is a brief high-level look at some of the visuals of the patient experience on the Notable platform. You'll notice a few things. One of them is that the platform is white labeled for any of our partners. You're looking at an example of what the platform would look like for an Intermountain patient with their logos, their brand, their colors. The same would go for any of our partners. You're also seeing on here how the platform is very modular. So all of these components are sort of like building blocks that you can then reassemble and stitch together to create new workflows that are unique to your health system. We've shown one of those here where we have a triage component, the second box, where the bot is doing an intelligent clinical triage to determine when a patient should be seen. From there, we've inserted our scheduling component, where this is Notable's web-based scheduling interface where patients can book an appointment with a provider based on any number of filters once they've been triaged. From there, you can insert a payment collection component like you see here, where the bot can input an insurance card, run eligibility, determine a copay, and collect a payment all through the Notable platform. And then finally is an intake component where we can service any number of forms, PROs, consents, and much more to the patients to have them complete those before the visit digitally, and then have that data automatically entered into the EMR via automation. So these are sort of the drag and drop components. There's many, many more that we haven't shown here that come together to make the platform as powerful as it is. And we'll sort of end on just a couple of last points before I turn it over to Carl. One of them is, we've shown the patient experience, but in the dual mandate, we have to also push the staff experience forward. And that's what you're seeing here. On the left is actually a bot doing its work using intelligent automation. So this may seem sort of incredible, but there are no human beings touching the EHR that you're seeing. That's a bot sort of working autonomously, filling out a power form, it's typing in text where needed, it's clicking into radio buttons. it can, sort of has this intelligent logic layer to be able to do work just like, many of your employees do. So whereas the status quo often increases manual work for staff with new technology, as Carl pointed out, at Notable, we deeply believe that anything that makes the patient life better should also improve the staff experience, which is what you're seeing here on the left.
So one of the areas that my background in pharmacy, when I started out, we were entering in every single order. So there was a mandate from the government on CPOE, computer physician order entry. Before that, we had CPOE, it was computer pharmacist order entry. Went to school to get a doctorate of education. 70% of my time was manually inputting orders. That was time that I was not spending on patients, adding value to that patient experience. And so that's part of the strategy that we wanted to take on, is start automating that, not because it eliminates jobs, but because it allows our staff to get the actual work done that they went to school and trained in, to add that value back to the patient.
Yeah, that's great. We have another saying internally that providers today have become the highest paid data collectors in the world, and so we have to change that. I'll sort of end this, this section of the webinar here, which is, some of the benefits and metrics that we've seen through intelligent automation. So how is Notable different? Consumer grade patient experience, not forgetting about delivering the best of patient technology to patients. Also working on work queue elimination for the staff experience and provider adoption that's unparalleled. We've shown just a few of the thousands of patient feedback we get on a daily basis, as well as some of our core metrics, everything from our patient satisfaction rating of 97% to real operational outcomes like reducing eligibility-related denials by 83% and eliminating hundreds of thousands of calls from the call center on an annual basis for our partners. With sort of wrapping up the dual mandate section, I do want to, transition over to Carl, and super excited to hear about how Fort Healthcare has employed intelligent automation to move the patient and staff experience forward. So Carl, over to you.
Absolutely. So just a little bit about Fort Healthcare. As I mentioned, we're about a $300 million regional facility. So we own a hospital, ambulatory surgery center, and 15 outpatient clinics in Fort Atkinson and the neighboring communities in Wisconsin. So these are our stats. One of the areas we say is that we're small but mighty. Those are some of the awards that we like to show. We've also, in 2020, were awarded, by our employees as a top workplace through Modern Healthcare. So we were really honored to receive that. That's part of the thinking that kind of brought us into the strategy. Seeing that we've been a top workplace for a long period of time, how can we, engage our employees and provide a more satisfactory experience, both for our employees and our patients? That's really our mindset and everything that we've done, and that kind of began the journey across. There has to be a better way to do this. So, next slide. So this is our. I really like this. Is our vision map. Kind of shows all of the areas that we serve and all the communities and our core values. So we are a very mission and vision driven organization. I'm giving this in my office right now, and this map is hanging on our office. It's hanging on every conference room that we have in every leader's office, reminding us of why we came to work. Next slide. So part of our core values is driving that patient and staff engagement and retention. It's really central to our continued independence. So I mentioned we're small but mighty. We're in a very competitive marketplace. So people can choose where they want to go. We believe that they choose to come here because they feel a part of what we deliver. We're a part of the community, and we're the top employer in the community marketplace. And, we want to have the top patient engagement and staff engagement scores as well. So we take providing care to our community very seriously. So we have this as kind of a life cycle, that as we engage patients, our staff is more engaged because they're operating at the top of their license. So part of our strategy is that we wanted to automate really the same mission that you had. We wanted to automate all repetitive and time-consuming tasks. So we went through this journey, not just on what can any vendor provide us, but we want to digitize the entire front end of that patient experience. And we want to digitize all areas where our staff are engaging in manual processes and move them to the top of their licensure. We believe that by doing that, by focusing on a really great experience, by engaging our staff, that will then translate and promote loyalty in our patients. They will want to stay with us because we'll be honoring our commitment to them. Next slide. So some of the strategic challenges that we've experienced at Ford Healthcare. So when we started on this journey, we had no automation. We weren't digitized in really any of our experiences, and our patient portal, our Compass, really left something to be desired. I say that as the administrator that is tasked to do all these other items. So that's, you know, nothing, no harm to any of our employees or anyone that's going into work. That was just one of our gaps that we really had identified. But we didn't want to rush into anything. We wanted to be very strategic about our partnership. And that once we picked a vendor, we wanted to maximize that vendor and client relationship to then really automate everything that we're doing and move us to not only being equal in the market, but being a market leader in this area. So a little slow to start, but being very methodical about what it meant for us as an organization in our community. So part of that strategic focus started at that quality meeting where they said, hey, just it'll take one more minute to add this workflow. We don't have one more minute. So again, by doing this, we're going to be non-competitive in the space, both because we're not going to be getting the quality scores that we need in this risk-based environment, and also because we're not adding value to the patients. Yes, that adds value to the patient in the patient life cycle and the spectrum of care that we provide. It does not add value to that patient where we have placed it in healthcare. So we wanted to automate this front-end patient and back-end staff workflows. We also had, really impetus of COVID-19 is we need to reduce the workload and burden on staff and providers. They are burning out. We can't hire in this incredible market on the great resignation that we are experiencing. So we had this impetus to be able to automate these experiences so that the staff that we do hire in are having a more rewarding experience, and the amount of work that they can get done per person exponentially increases. So some of the outcomes we have listed there, I won't go through that, but it'll be here for you to see after the when we send the slides out. So, next slide. So again, why we partner with Notable. I mentioned we were very strategic on our partnerships. It wasn't about what Notable offered, as there's a lot of vendors that offer. I mean, no offense, Muthu. There's a lot of vendors out there that kind of offer what you're doing. Really, why we partnered with Notable was that they complemented our mission and vision. Their company has really that same approach, and that is adding value to the community and patients that we serve, and not just adding on these modules that they have, and 6 to 9 months later, we can make a request, and maybe we'll be able to automate that experience. It's the speed and agility that they had as an organization matched what we needed to do in healthcare. So it was really a partnership approach that we're looking at, and it was really the first organization that we interviewed and experienced where even the areas where they didn't have 100%, they were listening. And by the time we had gotten through some of these conversations, we're able to modify our workflows to serve the unique challenges that our community has. Next slide. So the first areas that we have really focused on was prior authorization. At the time that we had contracted with Notable, we had just purchased an ambulatory surgery center, and we had several weeks worth of prior authorizations that were sitting and waiting for a human to send out to the portal. So this is providing a delay in care, a delay in surgeries, and a loss in market share. The longer that we go out, we know that there is a time frame. They can go elsewhere to get these surgeries done. And if they have to wait too long, they will. So what the first area was prior authorization. So we had about 2 times the volume of the work versus the staff that we had on site. So that was our really first platform that we needed to implement and really implement right away. That is a really important part of our patient experience. The second aspect that we did was registration and pre-visit planning. So pulling out some of those screenings and questionnaires out of that workflow and the patient experience. Come in 15 minutes early to do paperwork. When I have a limited time throughout the day, there has to be a better way of doing that. Allow me to do it in the comfort of my own home, and then just check in when I'm there and redirect the room. That was the vision that we had, and what Notable offered was all of that information, because we are a very data-driven organization, and this was a requirement of partnership. This could not be PDFs. This had to be discrete information directly entered into the EMR. We have to be able to pull this for all of the reports and analytics that we're doing. It has to sync with all of our other departments when we're submitting it off to payers. And so that was a requirement. That alone, I know that anyone that partners in the tech sphere, where a lot of what we purchase and add on is just this PDF dump, which is just completely useless to us. And the other area is broadcast messaging and appointment rescheduling. So that was probably the first area that we had ventured. We did, prior to going in with Notable, we did have broadcast messaging and available. We didn't really have appointment rescheduling available. It was, it was a two-way area where they could text our staff and we could reschedule. However, they didn't really hit with our strategy of being empowering the patients to solve that where they're at. I mentioned we're not directly staffed to address patients directly when they text us. So there's this gap in care when they're trying to contact us and when we're able to contact them. So we wanted to combine broadcast messaging to allow for point of click appointment rescheduling, so that when they hit that message, oh, hey, I can't make that appointment, can I reschedule? It allows them to directly do that and then sends them a reminder. So those were the 3 areas that were our highest needs that we're directly interviewing for on event. But again, it was that entire digitization that we were looking for and really wanting a long-term partnership with a vendor. So our journey to date, market research, partner interviews, it took about 12 months. We are a Cerner client and we're an IT work site, which means Cerner directly employs all of our IT people. We are a testing partner with Cerner, and we wanted a testing partnership with any of the clients that we went on. We understand the value that a really strong vendor-client relationship has. We have that right now with their EMR, and it's really made us directly competitive in our area because we've been able to directly kind of forge the EMR to work with our area. We wanted that with a vendor. A lot of what we saw in the market, which made it non-competitive, was a very piecemeal approach. So if it's a piecemeal approach, that means it will be good for a year. Then another year, I'm going to go through this whole aspect of now researching a vendor for the problem that I now have today, which didn't exist 12 months ago, or it did exist 12 months ago and we didn't know about it. So we wanted one vendor that would be with us for the solutions that we're currently looking at and then can grow with us. Notable was really that probably the only vendor that kind of hit all those key points, right? Can't be PDF, has to be discrete information, has to be able to grow with us, understands our mission and vision, and doesn't want their technology to us to shape our processes to their technology, shapes their technology to our processes. So then from there, it's been lightning speed. The pressure that we have had as soon as we kicked off, I mentioned, is we need this live right now. We are in the middle of a pandemic. We're in the Great Resignation, and we have so much work that needs to get done, and Notable can help us with that. So even with that being said, Notable has moved faster than we can even keep up. And so that's been a real grace and a life-saving in this time. So in October, we had the project kickoff. In November, we started on prior authorizations. And then in December, we went live with registration and pre-visit pre-visit planning workflows. So what I'll say is on the next slide, here's some of the analytics. Here's then where we have planned as well. And then the slide after this, we'll go through some of the success stories and some of the analytics of the solution. So go one slide back. Let me hit one more item on that. So what you can see in here in that gray is payment collection and cash posting. So, 12 months of research, October, we went live. And now in March, that solution you wouldn't have seen posted in any of the slides that Muthu has given you, because that solution doesn't exist. As soon as we signed, we had a need to automate cash posting. We had some retirements and some staff moving around, and this is a completely manual process, and it was a need. It really aligned with all the other items that we're doing. So all those other workflows that you see in there, in January, early January, late December, we met and we chatted on cash posting, and we have it scheduled to go live in March. So that's part of the reassurance that we picked the right partner. If you have a problem in IT, and no offense to the sphere, it just, I don't do it. I took coding in high school, and I'll tell you, I had to keep looking over at my partners and copying their code just to get through the class. It's clearly not the career that's for me. I understand how difficult it is, but usually it's, hey, we have a problem, we're going to research it. 9 months later, now we're talking about a go live, and it takes forever to get things done. Really from that conversation, we have this opening right now. Can you shadow it? Can you help us create a solution and work with us? And in a matter of months, we'll have a direct solution for this problem. So that was really a reassurance that we picked that right partner, and that they're going to grow and expand with us to meet our needs and not having us meet our vendors' needs. So next slide. So some of the early results, the one that I'm most satisfied with is that 91% on successful authorization submissions. So some of the other vendors that we looked at takes that easy 50% on prior authorizations that are really easy to automate. What Notable had told us in the meeting, and really talk is cheap, was, hey, most of our competition goes after the 50%. We target that hard 50%. Our goal is to get 100% digitization, and we won't stop till we're there. Sounds really great. What does the results actually show? Yeah, 91% of the authorizations that we submit after go live are successful. So we're not just targeting that easy 50%. We're targeting, all of them, and then our goal is actually with them. We want to implement this technology in all of our insurers and work with them to really automate until we're at 100%. So we're not there yet. We've just went live, but from the early results, it's a bold goal. It's a stretch goal, but I don't think it's impossible. The other item is the patient satisfaction. So really strong patient satisfaction on some of this. It's all across that age continuum and that patient experience. So one of the areas is no passwords. So I heard a colleague, when I was talking about kind of what we're doing, I'm like, yeah, we offer that in our portal through our EMR. And I was like, you don't offer what we offer. You offer where you have to go to a website, you have to put in a password as dual authentication. What we have been able to do through this is to have the patient be able to, through just their phone and the text messages, no password required, helps us assure who they are in a manner, and then quickly go through the paperwork that we've done. So being able to work for the patient and not have the patient work for us to get that care done. That's as easy as I can explain it. And I was really excited to see all those exclamation points, because it means that our patients are experiencing the workflow that we've created. So today's results, we went in to save time and really build staff capacity. So we're the top employer of our county. So we didn't put in this technology to let jobs go. It's something that we take very seriously here at Ford Healthcare. It actually wasn't part of any of the ROI that we distributed. The ROI was on labor capacity built, because I've been in healthcare a long period of time. Never have I went home and was like, oh, finally, all of the work that we wanted to get done finally got done today. There's never been one day in my whole career. There's always been more work that we've needed to get done. So we need all the staff that we have. We're not getting the work done. We need to be able to build the capacity that they can do. So move them from these manual tasks to verification and move them to the top of their licensure. So some of the time savings across all these different fields is about 24 minutes of staff time saved per patient visit for the front desk staff, NMAs. And I'll say we're really targeting really on the MA position, 45 minutes per patient per day time savings. So when you're looking at all of these time savings, what that really means is the capacity that we can see on a per provider basis increases. And there's two ways that we can go about that. They can take more time with the patient if they need, but then the provider has the ability to actually see more patients per day, not have to stay late, not have all this extra paperwork, because we've been able to remove out some of these manual processes and put it to the front of the patient experience before they even engage with us. Next slide. So key takeaways. Really, we all know this. The manual workflows are standing in the way of real transformation in healthcare. And is our opinion is the root cause of poor patient and staff experience. So we are being, really graded right now from our insurers and our patients on that patient experience. I get a better patient experience from my independent bank and my independent coffee shop than I do in healthcare. They have, obviously, their budgets are way less than we have. I get it, we're a little more complex than them, but we have to be able to deliver in that same model, because that's what people are experiencing when they're going out and getting any other service in the industry. So why can't healthcare be the same? We wholeheartedly believe that improving experiences is not a zero-sum game. If we take care of our staff will take care of our patients. That's our whole philosophy. That's why we're a top workplace. And quite honestly, I think we have been failing in that endeavor. I had mentioned we had no automation, we had no technology to support our staff. We owned that. It was no one's fault. We'll own that, and I will own that as the administrator. But we wanted to create that right vendor so that we weren't just being reactive. We weren't just piecemealing the solutions and it would never actually get solved. We wanted to create one vendor to help us with that whole patient care experience. I showed cash posting was one area. The other area that we're meeting on in, I think, a week or two is now our quality department. Really the same thing that we're doing in prior authorizations. Our quality department is having you submit that off to patient portals. That's another area that this technology we've already identified can help, and now can help support a whole different department. So already really quickly, we've went to automate nothing to start automating across that whole continuum for our staff. And we really believe it'll build a more rewarding workplace for our staff and a better patient experience for the patients that we serve. Next slide.
Great. Yeah. Thank you, Carl, for going through that and sharing your story and experiences. I hope everyone found that really helpful, as did I, honestly. As Carl mentioned, we believe strongly that healthcare can be propelled forward through intelligent automation. We're excited to take some questions now, so we'll transition over to the Q&A. And thank you all for joining us today on the webinar. We really appreciate it. And thank you, Carl, for joining us as well.
Yeah, and thank you, Muthu, for inviting me.